Good afternoon, and welcome all to Naples United Church of Christ. My name is Mark Williams, and I serve as senior minister here at Naples UCC. And on behalf of the congregation, welcome to all who are present and engaging this forum. Welcome to our panelists who have planned a wonderful discussion today, and welcome to all who are connecting with us online as well. I want to begin today with a special thank you to the Justice Committee here at Naples UCC, in particular the chair of the Justice Committee, Jennifer Walker. With mental health comes a certain stigma, and our Justice Committee's courage to break down barriers and to have this discussion this afternoon is worthy of celebration. Will you all join me in thanking them? Our house is your house this afternoon, and if you are in need of using the facilities, you can exit the south doors or the east doors of this building, and you can find the restrooms in either one of those locations. And I would mention as well that this is not our only community forum this winter here at Naples UCC, nor the only way in which we are engaging our local community. And if you'd like to be part of future events here at the church or one of our ministries, be sure to grab one of these next publications that is in the narthex of this building. I would close my remarks by sharing something that's personal, as I have a mental health professional in my own family. And so I am acutely aware that when it comes to mental health, and in particular youth mental health, when you are trying to do good or to make progress in this area, it is something where you have a sense that you want to do more and do even better for the next generation. And in working toward that, the challenges are vast and the problems are huge. And so on some days, it feels as though, quite frankly, you're attempting to empty the ocean with an eyedropper. That being said, this forum gives me hope about what could be and encourages me about what might be. Without further ado, I'll turn it over to Dr. Tom Felke, the moderator of today's discussion. Will you all join me in welcoming Dr. Felke?
Thank you all very much, and good afternoon, and allow me to also welcome you and give a thank you for joining us and taking the time out of your day to hear from our panelists, and hopefully you already had the opportunity to visit the resources that we have out front and have an opportunity to do that again after our event today. I have a few small housekeeping things as we start to get going. To give you a little bit of an idea of how we're going to proceed, each of our panelists will have time to present to you this afternoon from their particular perspectives and about the work that is done in their agencies. And then we'll open it up to a Q&A session where we would really love for you to participate in that by submitting your questions. So the purpose of today's forum is to provide information concerning the mental health of our youth here in Collier County, but also to provide information about the innovative programs and services provided by several of our local agencies to help support our youth and their families. We will, as I said, we'll have presentations by each of our panelists. Our bios for our panelists can be found in the pewbacks in front of you at your places. As well, you will find index cards near where the pencils are in the center of those pewbacks. And so that is what we would ask that you use to submit your questions. So you can just jot your questions on that index card. We'll have ushers going around during the event. So if you can just get their attention, submit your card to them, and they'll get those questions up to me so that I have them for our Q&A session today. In addition to the information that is going to be provided during the forum, as I said, that resource event that you saw at the beginning will still be here at the end of the event. So don't fret if you didn't have the opportunity to meet with anyone there. There'll also be the opportunity to speak to some of our panelists with some light refreshments after the event as well. So as we begin the session, allow me to acknowledge our sponsors for today's forum. Those are the Naples Daily News, Mental Health Collier Rotary, and the Collier Community Foundation. We are incredibly grateful to our sponsors for their support of this important event. At this time, I'd like to officially kick off the forum by introducing Maria Jimenez, CEO of the Naples Children and Education Foundation, and Maria will provide an introduction to the NCEF Youth Mental Health Initiative, and we're going to begin that with a brief video.
This is Conrad Henry Roy III reporting about social anxiety. The hardest thing for me is to be comfortable in my own skin, because depression is, I'm looking at myself so negatively. Will never be successful, never have a life, never have kids, never learn. But I have a lot to offer someone. I'm a nice kid. But it comes to a point where I'm just...
Unfortunately, Conrad Roy's story is all too common. Identifying mental health issues in children and adolescents can be extremely difficult to recognize and to diagnose. Often, early warning signs are missed until it's too late.
Tonight was beautiful. I saw the moon, I saw the stars.
She was such a happy girl.
Happy birthday to you.
And so motivated and so just full of life.
Dear Alexandra.
There was just so much joy in everything she did. And it doesn't match what was in that journal.
You are broken.
You are a burden. You are lazy. You're a failure.
I leaned over the embankment and looked down and I saw her. I was just hoping for warmth. Do you know what I mean? But there was no warmth. It was done.
Knowing that families are talking to their kids about their mental health, it lets me know that she didn't die in vain.
Problems such as anxiety disorders, mood disorders such as bipolar and depression, ADHD, conduct and behavioral issues, schizophrenia, and many other psychiatric conditions, if left untreated, leads to higher crime rates, pressures on the juvenile justice system, substance abuse, school dropout rates, and in the worst cases, tragedy and loss.
There has been one tweet that I would like to call attention to. So many signs that the Florida shooter was mentally disturbed, even expelled for bad and erratic behavior. Neighbors and classmates knew he was a big problem, must always report such instances to authorities again and again. We did, time and time again. Since he was in middle school, it was no surprise to anyone who knew him to hear that he was the shooter.
In the 2 weeks following the high school shootings in Parkland, our sheriff's office investigated more than 24 threats to Collier County schools.
Good afternoon. We put that video together in 2018, well before the pandemic. And I know those statistics and those stories have doubled, and the statistics are staggering. And so that is why we're here today. It's an honor and a privilege to stand before you as we gather on this crucial conversation on youth mental health. In a world that is constantly changing and evolving, our commitment and understanding to address the mental well-being of young people has got to be the most important thing that we do. We at the Naples Children Education Foundation support effective, disciplined, charitable programs that significantly improve the physical, social, and emotional and educational lives of at-risk and underprivileged youth. In short, we make a profound difference in the lives of children. You may have heard of our fundraising event. It's known as the Naples Winter Wine Festival. And we use 100% of those proceeds to invest in amazing programs like what you'll hear today. We embark on this journey to explore the intricate tapestry of youth mental health, a subject that touches the very core of our community, our schools, and our homes. Today, you'll hear from our experts in Collier County, and they are the front line of mental health. We are very fortunate to have an incredibly dedicated, committed, extremely competent, and skilled true experts in their field. I encourage you to listen with an open heart and an open mind. Engage in this dialogue with sincerity and empathy, and to be inspired by the strength that emerges from our collective impact. Everyone in this room and everyone on this stage, collectively, we can make a huge difference. Let me emphasize the profound importance of mental health services for our young people. I have a 30-year career working with young people. Early in my career, I worked with gang kids out on the street in some of the toughest areas of Miami. Let me tell you, the challenges that our kids face now pale in comparison. The kids back then had it much better despite their very, very tough areas and difficult upbringing. Our kids today live in a fast-paced world that changes every day, and this generation, unlike any other, is dealing with all kinds of things, and our need for robust mental health has never been more important or more crucial. The kids are navigating a complex landscape of dealing with academic pressures, social pressures, and ever-changing digital realm. Mental health is not just a personal matter, it's a collective responsibility that we all have to ourselves, to our family, to our community, to our schools, and the well-being of all children. Our role as a funder is to bring providers together and develop a plan. So we did that. In 2012, we brought this group and several others together and said, we need a plan. We worked together knowing that there was no other choice, we had to. And it was the cornerstone of our progress and the crucial endeavor of how we were able to come together. It required collaboration with educators, parents, healthcare, other funders, and the broader community. It was not easy. We had a lot of people saying, we're fine. We don't need any help. We can take care of the kids on our own. And it had to take a lot of different things, and sometimes a tragedy, just like what we saw in Parkland, to help people, encourage people to open those doors. So as a result, we've pooled our resources of expertise and compassion, and we created this incredible comprehensive network of support for children and families. And you'll learn all about those today. In short, we created a system of care and provided the right treatment at the right time. We still struggle with that because things are changing. The kids are changing, lifestyles are changing, the challenges are changing, and so to provide the right care at the right time always requires an adjustment. So we'll always continue to work on that. But since then, we've accomplished quite a bit. We've continued to identify gaps in services. We work together to address needs and strengthen the continuum of services. We ensure timely access to appropriate mental health. We added psychologists to pediatricians' offices. We created a functional referral system. We provided counselors in daycare centers, after-school programs, and even in the schools. We also added a number of healthcare navigators that support families when they're dealing with stress and difficult things, and they're looking for help, hope, and answers. I hope today is a journey of discovery for all of us. I hope that we are all able to find compassion and empowerment to continue focusing on this very important issue that affects all of our children and our entire community. I hope the insights shared today may become a beacon of hope and guide us to a future where mental health for our youth is the priority and is understood and vastly supported. Thank you for being here.
Thank you, Maria, and thank you to the work of NCEF to support organizations like the ones we have represented here today, and so many others that do important work on behalf of children and families throughout Collier County. At this point, in a minute, I'm going to ask Beth Hatch, who serves as the CEO of Collier's National Alliance on Mental Illness, to come up and provide some insight on the HUGS program. But first, we're going to begin with a video.
I have been taking care of Nathaniel since practically he was born. Nathaniel has always been a little rambunctious little boy. He's been a happy-go-lucky, just normal boy things. First grade is when we started noticing more behavioral issues in school, and he was diagnosed with ADHD, and so he was on medication.
He had been a Cambridge achieving student. He had done very, very well on all his scores, never had any real severe, any concerns about behavior. And then all of a sudden there had just been this real rapid decline and change in his behavior.
The end of April, Nathaniel started having like a psychosis episode that I had never seen him having before.
Rosa mentioned that he had forgotten how to do his chores, how to feed the dog, how to load the dishwasher. He had forgotten how to put on his socks. He had put his pants on inside out.
And it really upset me, and I got very concerned, to say the least. NAMI guided me to the process to get the help started.
Our team was working on ensuring that Nathaniel was in the proper placement that was going to best serve him, especially with these new mental health developments.
It gets really overwhelming. So for families, they can rely on NAMI. We ask all of the hard questions. We write everything down. We can compile all the information for them. We can communicate between the school and the parent and really make sure that parents feel comfortable, that they feel at ease that we're there to advocate for them, but also that we're moving the process along at a quicker pace because we know what our options are.
Just from that, everything kind of has this, fallen into place. Nathaniel is now in a special class where he's receiving more help, more support than he was before. I would definitely recommend NAMI Hugs program because they have been a great support system for me and for Nathaniel.
Good afternoon, and thank you for being here today and learning about such an important topic and need in our community. Nathaniel and his family, as you just saw, are just one of so many families needing our support. You'll hear today that Collier is so unique, like Maria shared, and we continue to collaborate with partners in the room today and others throughout our community. Collier is fortunate to have the supports, but not enough with the increasing needs of the youth in our community. All of us together here are making a difference, and we are just getting started. This past year, our program at NAMI Collier has had significant growth in adding a new clinical director, a parent educator and resiliency specialist, more experienced and degreed care coordinators, and most recently, a BCBA to our program to serve the increasing daily incoming referrals. The reason for this expansion: our community does not have enough doctors and therapists to refer our children to. Referring without months of waiting list, and for those who accept insurance, especially Medicaid, are just some of the barriers that our organization faced, let alone a family in crisis. For those reasons, we added to our team to ensure that the child and the family in crisis can move further along the continuum of care and get immediate services that are desperately needed and ensure that early intervention occurs as quickly as possible within our own program, and then continually assist that family with those in our community. These dedicated team members work together to ensure every child is screened, and those scoring in the threshold of concern now receives clinical oversight with an individualized goal plan to meet the needs of each child on the continuum of care model. Immediate evaluations, including global family assessments and the ADOS screening tool for when needed, are completed at NAMI now without a wait list and at no cost. Diagnosis, care coordination for the needs of the child and the family, advocacy, attending school and medical appointments, proactive nurturing handholding to identify and remove barriers, home visits for resiliency interventions and training, and a link between home and school for the success of the child and the stability of the whole family unit. NAMI Collier's Children Mental Health Program serves children from infancy through age 18. We are fortunate to partner with CCPS from pre-K through 12, or all the early learning centers, many of the early learning centers in Naples and Immokalee, and other community referrals. At the end of Q2, so that's thus far this school year, NAMI has screened a little over 1,100 children in total, and 260 of those children have scored in the threshold of concern just so far this year, and require further care coordination, clinical oversight, further evaluation, diagnosis as needed, and home interventions and strategies like linking home and school. The national average for adults living with mental illness is 1 to 4, youth nationally 1 to 6. So far this school year, 22% of our children screened are needing further evaluation and care coordination and services. So in relation to the national average, by the end of December, we have about 4.5, we'll say 1 to 5 ratio. The silver lining to these numbers is that early intervention is being received by the children and their families in their greatest time of need. Like Nathaniel that you saw, with such a drastic difference to his ability to simple functions, is an example where immediate action was needed. Our brains are amazing organs. Unlike many other of our body parts, it's remarkably elastic, meaning it has the ability to change and adapt. Our brain has the ability to be flexible, particularly the adolescent brain. It's a key reason early intervention is important and also effective. Early intervention can also save a child and their loved ones from further stress, prevent more serious symptoms from developing, and reduce the likelihood of problems with work, family, school, and many times substance abuse as it affects the whole family or those caregivers. For those who've made investments in our youth mental health programs here in Collier County, we thank you. And you are reducing the medical costs and the overall burdens on friends and family members in our community as a whole, and ensuring that no child or anyone is ever alone on their mental wellness journey. On behalf of all the children and families that NAMI serves, we are grateful for you. Thank you.
Thank you, Beth. A wonderful example of the type of innovative programming that we have going on here in Collier County to support our youth. And Beth, you mentioned the connection with Collier County Public Schools, so it's only fitting that next I introduce Rick Duggan, Executive Director of Exceptional Education and Student Support Services with Collier County Public Schools.
Good afternoon, everyone. It's truly wonderful to be here with you today. I'd like to begin by sharing a personal story that connects my career journey with the important topic we're discussing. In 1998, armed with a master's degree, I embarked on my professional journey with the school system as a therapist, working with students with severe emotional disabilities in special education classrooms. Over the years, my path evolved, leading to becoming a certified in applied behavior analysis, focusing on students with autism and cognitive disabilities in the late 90s and early 2000s. Surprisingly, my trajectory towards educational leadership began with encouragement from district administrative staff who recognized my dedication to working closely with some of our most challenging students. Fast forward to 2010, after taking a job as a coordinator with the district office, I distinctly remember having a conversation with my wife and saying that it was odd closing the chapter on my life where I worked in mental health. That's not to say that we didn't have mental health issues with students, but they were mostly students in special education programs throughout the district, and they had ample support. Well, that notion was short-lived. I looked back through some of my old emails and notes and found an email from my predecessor, Karen Stelmacke, that summarized a great meeting we had with the David Lawrence Center in mid-2013 after Sandy Hook in December 2012. During the meeting, we discussed how both entities could better collaborate and share information about students receiving outpatient treatment or who had a crisis psychiatric admission and would be heading back to school. Interestingly, this was the same year, 2013, that the term selfie began proliferating with advancements in cell phone technology, allowing people to take pictures and post them on Instagram and Snapchat, created in 2010 and 2011. Subsequently, we would have the Parkland tragedy in 2018 and close schools for 3 months in March of 2020 due to the pandemic. My point is that 10 or 11 years is a long time, but it's also a blip when you consider how much our lives have changed in this time period and how our mental health systems have had to evolve in that time. Suffice it to say, in 2010, work in mental health was just beginning, not ending. Currently, Collier County Public Schools employs 28 mental health professionals, 35 school psychologists, 25 behavior analysts, and over 100 school counselors. The monthly mental health work group that we started with the David Lawrence Center and the Collier Sheriff's Department, that was many years ago, has grown to include 40 members. Most recently, the work group is focused on the rising number of emotional and behavioral challenges in kindergarten students, emphasizing the need for early intervention and outreach to our pediatric providers. A key district initiative aligned with student needs and legislation is the 8-hour youth mental health first aid training for all staff interacting with students. This includes not only teachers, but also office staff, nutrition services workers, bus drivers, and assistants. Youth mental health first aid teaches adults how to assist adolescents facing mental health issues or may have a history of trauma. The training focuses on common mental health challenges and a 5-step action plan for crisis and non-crisis situation, including how to refer a student for more help. Over 80% of Collier staff that work with students have been trained in youth mental health first aid to date. Additionally, every school in Collier County has a comprehensive mental health team that includes a licensed mental health professional, a school psychologist, a school counselor, school nurse, and a youth relations deputy. It's important to include these last two members, as often a school nurse may see students in the clinic who have a physical response to an underlying mental health issue. And our deputies can help us when there are issues involving cyberbullying, threats, and in situations where the students may not feel safe or that they're in danger. Over 7,500 students received counseling services last school year, the majority of which involved short and medium-term cognitive behavioral therapy and solution-focused therapy. Any student who is in crisis can be seen by a school-based mental health provider. However, parents must give permission for students to receive ongoing intervention and support from a mental health professional. Students who require more intensive therapy can be referred to many of our community providers that are here today. It's important to understand that the primary goal of a school-based mental health treatment is not as in-depth as outpatient therapy. We're trying to provide a level of support to ensure that students can reach their potential. However, school is not always the best place to unpack childhood trauma. Research indicates a complex landscape contributing to the rise in mental health issues among young people, including extensive trauma histories related to addiction, domestic violence, homelessness, and family instability. Additionally, the pervasive influence of connected devices, texting as a primary method of communicating, social media, and the 24-hour news cycle that focuses on the latest tragedy exacerbates these challenges and can distort our perception of reality. To address this, several school boards, including ours, have implemented limits on cell phone use during school, resulting in increased student engagement and deeper interpersonal connections among students. I urge our parents, grandparents, and extended family members out there to work to limit the amount of time they, as well as their child, spend looking at and interacting with screens. There are many other initiatives in Collier County schools that I could go into, but in closing, I want to emphasize that despite these challenges, there is good news. We have seen a dramatic decrease in the number of students requiring a crisis psychiatric admission. And as I mentioned previously, our students are more engaged since putting limits on cell phone usage in schools. We have seen an increase in the capacity of our mental health workers decline, resulting in decreased wait times, more continuity of care. By maintaining our collective efforts and raising awareness through events like today's forum, we can continue to bridge the service gap and address the mental health needs of our community. Thank you.
Thank you, Rick, and may I say on a personal note, as the proud dad of 2 boys in the Collier County School District, I am so thankful for the work of your unit, the licensed mental health, behavioral health staff, and all the staff in the CCPS, so thank you. Likewise, in my role as a social work educator at FGCU, I am also thankful for the next individual whose resources and information I've accessed several times to prepare for lessons and to train the next generation of mental health professionals for Southwest Florida. Dr. Javier Rosado serves as the Director of Clinical Research at the FSU Center for Child Stress and Health.
Hello and good afternoon. The Florida State University College of Medicine Isabel Collier Reed Medical Campus in Immokalee focuses on training the next generation of physicians and psychologists in a model of healthcare known as integrated care. Integrated care involves integrating mental health services into primary care settings to accomplish 2 things. The first would be to provide early interventions within the primary care setting that will help reduce the risk for later chronic mental health symptoms and conditions that would need a higher level of care. And the second would be to treat comorbid conditions that include mental health symptoms and medical conditions at the same time. Over the last 2 decades, we've seen an increase in the comorbidity of mental health conditions and medical conditions that co-occur simultaneously. In order to ensure that there is the appropriate workforce to address these comorbid conditions, FSU partners with different clinical sites like the Healthcare Network, who you'll hear from today, to implement integrated care models into clinics where students can train. As such, the FSU Center for Child Stress and Health was created to serve as a resource center for families and healthcare providers to address comorbid conditions. The center focuses specifically on something called toxic stress. The best way that I could describe to you what toxic stress is to give you a personal story. Not too long ago, actually a while ago, I was going to my car very late at night. I had left something behind that I needed. And as I was walking outside of my home, I could feel the presence of something or someone. I don't know if you've ever experienced that before, where you know you're not alone, but you're not quite sure who is with you. That's the feeling I got. So of course I stopped in my tracks and I'm looking around trying to figure out who is this. And I see like these little shiny eyeballs that are glowing in the dark off to the right about 10 feet away. Kind of like cat eyes. Have you ever seen a cat in the dark? Except these eyeballs were not close to the ground as it would be if it had been a cat. They were more like 4 feet up and it was a big black bear, right? Only about 10 feet away. And so the moment I realized my company was a bear and not a cat, I could feel my heart racing, right? My breathing rate altered a little bit. I could feel a rush of hotness, heat come to my head. And what was happening was my body was activating its stress response system, right? It was preparing me to fight or flight. I was either going to fight this bear or I was going to run as fast as I could to get away from the bear, which is what I ended up doing. But in my case, what activated my stress response system was a bear, right? But for many of the children who we work with, their bears are other things, like I got home last night and my mom and dad are fighting yet again, right? Or someone posted on social media something that isn't true about me, and now everyone thinks I am such and such, right? And these experiences happen repeatedly over time. Whenever a child's stress response system is constantly being activated over an extended period of time without the right buffers and supports in place, what happens is they are at higher risk to experience both chronic medical conditions, especially later on in life, and comorbid mental health problems. So our center aims to create resources and services to help families who face such challenges. One of the things that we do is we've created a screening program to identify kids who have been exposed to toxic stress. On the screen, you see some of the results that summarize the adversity and the percent of kids in our programs that are based in Collier County, in Immokalee specifically, who are exposed to adverse experiences. We categorize these adverse experiences into 3 groups: abuse, neglect, and household dysfunction. So if you could see from the statistics on the screen, anywhere from 6 to 9% of the kids we work with are endorsing that they've experienced physical or emotional abuse. And those numbers are quite high for that type of abuse. About 9% endorse that they've experienced physical neglect, about 21% emotional neglect. Now, I should note, these are children and adolescents self-reporting that they have experienced these things. So their experiences are important. Not all of them may meet the criteria for a report to a child protective agency like DCF, for instance, but they are experiences where the child feels that they're not having their emotional needs met, so they're significant. And then there's household dysfunction. This includes things like having a concern that a parent in your household has a substance abuse problem that's untreated. About 34% of our children endorse such. About 18% of the children we work with will also share that their parents have an untreated mental illness. So this is a concern, like, yes, my mom or my dad is depressed, or they're anxious, or they have another parent who's experiencing mental health symptoms and is not receiving the help that they need. Now, we know that children who are exposed to these adversities are at a high risk for comorbid mental health and medical conditions, but not only do their own adverse experiences place them at risk, the experiences of their parents also place them at risk. So on the next slide, you will see results from the slide just prior to this one. You'll see results from another study that we're doing right now, where we're aiming to identify parents who have experienced adverse events during their own childhood. So what we do is we screen expecting mothers, we get a thorough trauma history, and we identify which children who have yet to be born will be at risk for these comorbid conditions. We provide support and intervention during pregnancy, and then follow those high-risk children for the first 4 years of life. During those 4 years, we provide close developmental surveillance and intervention as well. So what's important to note here is that, yes, a child's adversity increases their risk for these comorbid conditions, but their parents' adversity does as well. And these statistics are even more staggering. If you look across the same 3 categories, the percent of expecting mothers exposed to sexual abuse that we're working with are as high as 20%, 35% endorse emotional abuse, 33% endorse that they've experienced some form of neglect during their life, and 33% have been exposed to some form of domestic violence. So these are all factors that we know place children, families, their parents as well, at heightened risk for these comorbid conditions. So what conditions are we talking about? On the next screen, you'll see a few. This includes depression, pulmonary disease, asthma, kidney disease, stroke, heart disease, cancer, diabetes. The good news is that we can have a significant impact if we intervene early. On the next slide, you'll see how much improvement we can have with the right interventions early on at the appropriate stage of a child's development. We can reduce depressive disorder by 44%, pulmonary disease by 27%, kidney disease by 16%, cancer and diabetes can be reduced by 6% as well if we provide the correct interventions at the right moment in time. But we need the right workforce to do this. We need the right workforce that knows how to treat these comorbid conditions. And then we also need a healthcare system that allows us to do that. We know how to identify children who are at risk, but oftentimes the infrastructure within our healthcare system only allows us to treat people who have been diagnosed with a condition, not to prevent the condition. And so that limits our ability to provide the preventative services and interventions that are necessary. That's why programs like NCEF are so important, because they help to fill the gap and really have an important impact on the children and families that we treat. Thank you for your support and for your time being here today.
Again, thank you, Dr. Rosado. I know what I'll be covering in my social policy course. Before we move on to our next panelist, I'd just like to make a quick reminder that you have index cards and pencils in your pew backs. If you have any questions, please feel free to jot those down. Let our ushers know. I see someone over here is waving a card, so if we have individuals who can pick those up and bring those up to me, I'll make sure that we have those for our Q&A session. For our next panelist, very pleased to introduce Jamie Ulmer. Jamie serves as President and CEO of Healthcare Network, and he will be talking to us a bit about inclusion behavioral health.
Good afternoon, everyone, and thank you for having me today. You know, when I think back about all the work that goes into these forums, I remember when I first got to Collier County about 18 months ago, Ms. Jennifer Walker was working on the Forum for Workforce Housing. And I knew there was a lot of work, but I had no idea. But I do know that that forum was very impactful. And so we were in here rehearsing last week, a full dress rehearsal. And, you know, that's Ms. Walker, that's how she's going to have it. And I said to her, that forum last year, this forum this year, what's the forum next year? And she looked at me and she said, yeah, right, yeah. So it's truly a blessing to be here today, because I fully understand the amount of work that she's put into this as I have been able to participate today. You know, it speaks volumes when you're a part of a community and everyone is coming together to make an impactful difference, and that's what we've been able to do. So I'm representing one federally qualified health center that there are 1,400 across the entire country. Of the 1,400, the state of Florida has 54 of them. Collier County has one, and that's Healthcare Network. We see in the state of Florida close to 2 million patients across the entire state, and we are in all 67 counties. This is extremely important because we are the only primary care infrastructure when it comes to healthcare in the state of Florida. Yes, we have hospitals, and obviously they are placed throughout our entire state. But when it comes to a primary care office, we're the only infrastructure that the state has. And it speaks volumes that when you have an integrated behavioral health system embedded with our pediatric offices. You know, if you had a chance to read my bio, I was once in the military. I'm not going to say about how long ago. And I was a medical service corps officer, and I was in a combat zone. And what I noticed is that when my medics would have a soldier who was having a behavioral health challenge, we would evacuate them back theaters of operation into a military hospital. It may be even in a different country. We never saw that soldier again. Someday someone said, why don't we bring the behavioral health counselors all the way down to the front line? And so we tried it. So we brought the behavioral health counselors from the hospitals, you know, good food, movies, and everything, all the way to the front line, and they started addressing challenges that soldiers were having right there. We didn't lose one soldier. They stayed in the fight. Now, I would submit to you, those behavioral health counselors didn't like that, but it made a true difference of providing the care at the front. Next slide, please. So, perfect. You were there. You can go back one. So our unique approach to this, from what Dr. Rosado really spoke about, is a behavioral health integrated program with our primary care providers. So imagine this. You walk into your pediatric office with your child, and while you're seeing that provider, either a well child check or a sick call visit that you're trying to get them back into school, and the doctor identifies through a checklist a behavioral health concern. And they say, excuse me, walk out of the office and either bring someone into that exam room or hand you off to a behavioral health counselor that can begin to address a challenge right there on the spot. That is the unique approach that we have. And so I would submit to you, as you do bring your children in, and other primary care offices have this integrated program, it is identifiably very impactful for our patients. Next slide, please. So what is that impact? There are over 40,000 children in Collier County. 55% of them are our patients at Healthcare Network. Over half of those 40,000 children come to us. And so they're having the ability to experience what a integrated behavioral health model is. And some of the statistics that you've heard today sometimes is doom and gloom, but it's not always doom and gloom. When I look at Collier County, it is the #1 healthiest community in the state of Florida. That doesn't come very easy. It's because of forums like today. It is because of the NCEFs of the world, or the only NCF. It is because of our Naples Rotary Club. It is because of the Community Foundation and what this community has done to make a difference with our patients and our children. But there are still a lot of work to be done. Because without those organizations, we probably would not be the healthiest community. Now, you might not be able to afford to live here, but we've made a tremendous difference with our health and our children. Next slide, please. So why don't more pediatric offices in our community have an integrated behavioral health system? Well, when you have almost 6,000 patients, children who do not have insurance, what are they going to do when they pick and choose? Do I come for a sick visit and get my child back in school, or get the well child check annual visit? I pay for that. Or do I pay for that and a behavioral health visit? Probably not. They're probably going to take care of their well child check or their sick visit and not able to do the behavioral health. The stigma. We heard an earlier speaker talk about the stigma. We are in a multicultural community. And when I say multicultural, I'm talking about really multicultural, with different ethnicities, and different cultural values and stigmas come with that. And so when I think about them opening up to saying that they have a behavioral health challenge, it's extremely difficult. And finally, policy and reimbursement rates. I have spent copious amounts of time driving back and forth to Tallahassee, as some of the panel guests have, because I bumped into them in Tallahassee, addressing our pediatric reimbursement rates. And I am proud to say and really confident that our Senate President Pasadoma will address that in her Live Healthy Act, because without increasing those pediatric rates or primary care rates in general, it lends to us not being able to increase access for behavioral health services. So I'm confident that those will be addressed. Next slide. The benefits and solutions to what we've been able to accomplish is absolutely amazing. Providing behavioral health services in the same place at the same time is a true asset that we are able to do with an integrated model. When I think about school-based health care, although Collier County does not have a school-based health center, we are working very closely with Collier County Public School Districts and funders to potentially be able to set up a school-based health center to continue the efforts that Collier County Public School District is doing with integrated behavioral health services. And finally, I'd like to say the Boston Children's Hospital Training Program. Naples Rotary Club conducted and funded a pilot program with the Boston Children's Hospital Training Program. This training program was the first step to providers who did not have this integrated model being able to understand how to provide services, identify a patient who may be having behavioral health challenges, and walk through steps with a workbook with the provider, the parent, and the child. And this has been tremendous across our community, and we are proud to say that the Rotary Club of Naples has funded us for another opportunity to do this once again this coming year, to be able to train providers in our community how to identify and then walk through the steps. Because as we've heard today, workforce with behavioral health counselors is difficult, and this may be a step to help us to get to that point. I'd like to show you a video on this, and again, thank you for having me.
One of the most challenging things about being a parent is just finding the balance. I have 5 daughters. They're all different. What might work for one might not work for the other. It's just hard. My kids have a big trauma in their life. My child's father passed away. When she was little, a teacher told us, you know, she doesn't look at us in the eyes. She wouldn't sit still. In kindergarten, she couldn't pay attention. So we did see some things in Gianna, just like we saw in Micaela, but a lot more came out once their dad passed away. It just became even more difficult.
I had a really hard time with math. The way they explained things to me was really confusing, and I just couldn't understand anything. Reading was a struggle, and I couldn't read any of the packets or anything of the instructions. So it was really hard to read and write.
My anxiety was really bad, and I had panic attacks multiple times a day, every single day. That was probably the hardest point in my life. I just felt like everything was crumbling in on me.
It's hard. It's very hard. I felt like I was drowning, but even worse, she felt like she was drowning. And I didn't know how to get her out of there. So I came to my doctor's office to ask for help. I met with Dr. Anzalone and Dr. Tam, and then I was introduced to a toolkit.
One of the things that we focus on in our clinic is teaching basic coping skills, and one of the very helpful resources has been using the toolkits from Boston Children's Hospital. They teach small, evidence-based ways to reduce anxiety, reduce depression, and manage behavior in general. And through teaching those skills, one, you can help individuals with all levels of severity, and it also keeps people from having unnecessary treatment, time, and costs.
To have it organized in a way that you can actually focus on each child's issue and have an ability to be able to manage each child personally and in a way that it's going to be meaningful for that child's issue is going to help her, because it can be overwhelming. But when we can give people the ability to organize it in a way that makes their lives easier and bless their children in a way that they can heal, empowers her.
When I read it, it just all clicked. It's kind of like, wow, I'm not the only one that's going through this. I'm not crazy. My kids are crazy. There's people that understand and other people that are going through the same things that I'm going through. So it helped me.
It's amazing, honestly, what these toolkits can do. If you just read some of the information, it makes a lot of sense. It felt great. It made me feel better. I'm definitely doing a lot better these days than I was before. It was great.
Today, the girls are doing good. They're much better. You know, every day we're still working on stuff, but much, much better. The girls have improved a lot. If you're a parent wrestling with this, I've been in your shoes. Read it, give it a try, and it works.
Thank you, Jamie. Excellent work being done at Healthcare Network, and very much looking forward to the continuation and expansion of that Boston Children's model. At this time, I'd like to invite our next panelist to speak with us. Dr. Jason Sabo serves as Psychology Site Lead and Behavioral Health Section Chief for Lee Health Systems.
Thank you. That video was super impactful, especially to me. My father passed away at 9 years old. My younger brother just didn't have the services that are available today. It's really why I got into this and why I became a psychologist, is because I really wanted to make an impact. The services that you're listening to today are services that would have gotten him that help early on. It would have given him the ability to meet with somebody and have early intervention. So it's just incredible. Another thing that is really important, standing up here, that I hope the folks listening understand, is that the mental health community around here, it's not a sense of competition, but rather collaboration. The providers, the networks, all of the different organizations, it's really a sense of teamwork, and it's an amazing thing to be a part of. So here in Southwest Florida, we're so blessed to be able to have that and to be able to benefit from that, and our children are really the benefactors of that. So just thanks to everybody here. I want to start off by really sort of laying the foundation of some of the things that I see, and really the importance of getting early intervention and the importance of a mental health forum. My first slide, I'd really like to emphasize some of the statistics about mental health, giving both a nationwide perspective, but also a community perspective of here in Southwest Florida. Almost every area of mental health severity and anxiety, depression, all of them have significantly increased. Suicide, as we discussed earlier, is the second leading cause of death in youth and young adults in the United States. And unfortunately, it's doubled in the past decade. From March to 2020 to October of 2022, mental health related emergency department visits increased 24% in children ages 5 to 11 and 31% for those aged 12 to 17, compared to emergency visits in 2019. Next slide. Self-injury is also an area that we see in our practice that has increased significantly. A meta-analysis, and this is information that's taken before the pandemic, and so it's important to note that this is something that has been increasing before the pandemic, before the hurricane, and before some of these other crises have come up. About 17% of all individuals will self-harm in their lifetime, and what that is when you cutting, burning themselves, hurting themselves in some way, and a lot of time that's a way to relieve emotional pain. We see it a lot in mental health diagnoses, especially with anxiety, depression, and it's something that's really, really significant, and often, if it's not treated in an early age, can lead to something more significant. What's really surprising about this is that the average age of first time of self-injury is 13 years old. I think about my son and the pain that would ensue, or would be happening for something like that to happen. These are kids that not necessarily just our kids. They're the kids that our kids are hanging out with. They're the kids in a community. And so when we think of just our kids, it's something that's happening all over. And even if it's not just your child, I can almost guarantee that it's happening to one of your child's friends, somebody that they play sports with, somebody that they're in school with. And so it's impacting us in multiple different ways. Next slide. During the pandemic, 20% of teenagers said that they considered suicide. We had a 55% of high school students said that they experienced emotional abuse from an adult in their home. In addition, 11% saying they experienced physical abuse. At Golisano Children's Hospital, we had a significant increase in kids admitted to the emergency department for that. A lot of times what we saw with the pandemic is that while they're at home, they weren't around schools, which were able to really be able to see what was going on, and so we had a lot of these kids who were going really untreated. Locally, Golisano Children's Hospital had a 494% increase in hospital admissions during the first 8 months of the pandemic. If you don't know what a Baker Act is, that's when a child is involuntarily hospitalized for a mental health crisis, generally because they want to hurt themselves or somebody else, so they're a danger to themselves or somebody else. That's just absolutely out of control. Next slide, please. The percentage of teenagers saying that they had persistent feelings of sadness and hopelessness rose from 26% in 2009 to 37% in 2019. A new survey in 2021 had 44% of teenagers saying that they felt that way. During that time also, suicide attempts had increased from 6% to 9%. As you can see, and some of these numbers are pre-pandemic and also post-pandemic, there was a mental health crisis brewing way before the pandemic happened. To put it into sort of like a cooking analogy, we were in a slow cooker, and now we're in a pressure cooker. Next slide, please. Now I'd like to talk about the current state. 1 in 5 children, ages 3 to 18-year-olds, suffer from a serious mental health illness. 80% of those children are not going to receive the treatment that they need. 37% of students with a mental health condition age 14 and older drop out of school. That's the highest dropout rate of any disability. Southwest Florida has a 750-to-1 ratio of population of mental health providers to the national average, which is 350-to-1. Now, a lot of our presenters have talked about early intervention, and I think that that's so important. If we don't have the providers there for intervention, the prevention is so important. Many of these providers are being able to identify children early on so that they don't have to come to our clinic and so that they can be treated early. We have 2 of the providers in our office that went through the FSU program and just doing an absolutely phenomenal job. It's something that is incredibly important in our community and also something that's really helping our youth. Next slide. There's been a sharp incline in the onset since the pandemic. However, before that, there had been a 10% increase year over year in pediatric Baker Acts in our area, while in this whole state of Florida, there's been a 5% decrease. Next slide. Currently at Lee Health, we've been having incredibly long wait times. We have 8 months to see a developmental pediatrician, therapy up to 2 years, and we have over 500 kids on our wait list. Psychiatry 4 to 6 weeks, and urgent psychiatry cases within 2 weeks. This is all while we've added 3 additional offices. We've added, next slide. We've added outpatient programs, and we're going to be adding our 4th location to Cape Coral next year. We've partnered with Lee and Collier County School Districts to expand Mental Health Navigator program. The Mental Health Navigator program, if you don't know what that is, it's providers who are embedded within both Lee County and Collier County schools. And so their goal is to identify children early on that need assistance and that need help. Some of the statistics from their work are just absolutely amazing. They've been able to increase attendance 70.5% of the folks or the children who have been in that program. And even more importantly, they've been able to decrease hospitalizations by 71.5%. They're also involved in community parenting classes. We're also developing an autism testing center. Next slide. And a lot of this has been really due to Kids Minds Matter. Kids Minds Matter is a program that has been able to really kickstart a lot of the behavioral health services at Lee Health and Golisano Children's Hospital. Since Kids Minds Matter has gotten involved, they've been able to increase the outpatient pediatric mental health visits by, you see the number, which is just absolutely wild, 1,546%, and that's just the positions that they have added through their funding. There's been a 500% increase in the providers that they've added. Over 1,000 people have been trained through their mental health first aid class. Mental health navigators embedded in the Collier County schools and Lee County schools, and then more than 300 families have been served through the mental health navigator program. We're also having our annual fundraiser, which is on February 7th here at the Arthrex Center for Kids Minds Matter. It's an incredible organization, and I'd really encourage you to go online at kidsmindsmatter.com and look at all the different services that they offer. Before I finish, I really want to thank each of you for attending, both in person and then folks watching online. Your presence really lends me to believe that you're part of the solution. I guarantee that each of you have been affected by the current mental health crisis. It could be a friend, a child, a grandchild, but it affects us each. And we also know that early intervention is critical. My hope is that from this forum, it can serve as a catalyst for advocacy. So thank you.
Thank you, Jason, and I think that's a powerful analogy when you talk about going from a slow cooker to a pressure cooker, and one that all of us can relate to. Last but not least, our final panelist for the forum today is Scott Burgess, CEO of David Lawrence Centers for Behavioral Health, who will discuss some of their programs and the vision for DLC. Scott?
One evening, about 11 o'clock at night, I got a call from Chloe's best friend, and she said that Chloe had cut and she was unable to stop the bleeding. She had cut 30-something times on her leg and had gashing wounds.
I didn't start cutting right away. It helped more of as like a release, like an immediate release, not like something that would take over time to heal. It was that exact moment, that exact relief, that exact release. I discovered on social media that every time I went on there's a lot of pressure to be this perfect filtered image, and that's not life, and that's not what I want my expectations to be.
1 in 5 children are going to struggle with a serious mental health challenge in our country. That means with an average classroom size of 30, there are 6 children in every American classroom that are struggling with a serious social emotional issue, and yet close to 80% of them are not receiving any care. We've seen that growth continue to happen year over year. Children are struggling more and more, and they're struggling with thoughts of harming themselves and sometimes harming others. And we've seen with the Parkland situation how important it is to make sure that we identify these issues and get children into treatment as quickly as possible.
The hardest part about, in hindsight, dealing with my daughter's depression, suicidal thoughts, self-harm, was not having the answers and not being able to help her. I took her to the David Lawrence Center at that point. I didn't know what to expect. I just knew that we were getting so dangerously close to losing her. After a couple days in the crisis unit, they had put her with the CAT team, the community action team at David Lawrence Center, and it was the best thing that ever could have happened to us.
Each and every day through our crisis intervention services, we are saving lives and we're keeping our communities safe.
So 3 years ago today, I was in a really dark place. I was in this hole, and today it's a lot brighter, happier, and I have a new look on life. I appreciate that David Lawrence Center gave me a place to be myself and to feel feel safe from myself, because at the time I was really not trusting myself. I didn't know my mind could get that dark. And for them to give me a place to finally trust myself and be free from myself was what I needed at the time.
Family today is stronger than it's ever been. There's been so much growth that has happened. The communication is open. We don't judge each other. So if Chloe or anyone else in our family is feeling this way, we now know how to help them. And we are that positive ending. We're the happy ending. And I feel so blessed.
We need you to stand up for people and children like me that are struggling.
We stand ready. Now we need you to stand with us. We can't do it without you.
Well, it's an absolute honor to be here today with all of you who have chosen to be here to learn more about youth mental health challenges that are in our community and a crisis in our country. And it is an honor to be with my esteemed panelists who I just feel absolutely blessed to work with each and every day in this community to try to bring the care to children and families in need. I think it's really important for me also to immediately thank Chloe and Adrian, her mom, who are willing to share their stories bravely. Still, unfortunately, in today's society, there's a stigma out there, and it oftentimes causes people not to be willing to share their stories. And that's really what we need to do, is to get mental health issues out of the closet, talk about them like any other health care condition. There should be no stigma, no shame attached to the organ in our body. We've got many organs in our body, and we happen to have an organ that's the brain. And there should be no difference in talking about mental health care in healthcare than any other form of healthcare. They bravely were willing to share their story, and I think that is amazing that they did that. And I thought I would also provide you a little bit of an update. You saw about a 3-year transition there in Chloe. There's been a few more years since then. She has now successfully graduated high school, successfully graduated her nursing program. She is a nurse working in the community helping others, and she has a sense of empathy and compassion that I think extends beyond what we can really imagine, and what she's providing in reaching back and helping those in the healthcare community that come to her for care now. So that tells you a lot about the story about mental health treatment, and puts it in the light that I like to say, which is treatment works. We know treatment works. All the data's in, all the evidence is in. This is not what folks used to consider kind of a death sentence, that you're only going to get worse if you happen to have a mental health challenge. We know that the exact opposite is actually true, that if individuals receive the care that they need, that they can be very successful. And so again, I'll talk a little bit more about some of the statistics that we know related to that and how that is playing out here in our community. But I also just wanted to take an opportunity, as we're thanking all the partners that we're working with, and certainly NCEF and Community Foundation and so many others that help support what we do in our community. I noticed that Andy Solis is here today, a former commissioner in Collier County, really a mental health champion for our community. He led the effort for us to build our first strategic plan on assisting those that have mental health challenges and substance use challenges in our Collier community. So I just wanted to say thank you for consistently being here and all your help and support. Just to talk a little bit about David Lawrence Centers and the work that we provide in the community as a partner in this important initiative. We've been in the community for 56 years now, and we are the Community Mental Health Center for Collier County, and we provide a whole array of different services in our community. And you've heard about some of the forms of service, including early identification and prevention and intervention and integrated behavioral health.
We provide supports in a number of those areas, but also when it gets more into a situation where it's a moderate to severe or significant mental health condition, we provide a lot of intensive supports around that. So you heard about the Baker Act. We are the only Baker Act receiving facility in Collier County, so that assists with children. So when children really meet that crisis state and they are a danger to themselves or they're a danger to others, they will come to David Lawrence Center, and we have an inpatient children's unit for them. We provide crisis care and assessment 24/7, 365, and that mental health unit is available to children in need that reach that threshold of challenge that they're going through. In addition to that, and the average length of stay for a child, that's usually a question that people have, is how long do they typically stay in our care? And it's usually about 3 to 5 days, so we can do a lot of intensive support helping the child and the parents in that amount of time. And then we step them down into other supports, and we have some additional more intensive types of supports. We've got a children's day program called Partial Hospitalization Program, which is very helpful to build on that recovery from the challenge that they were going through, and layering on top of that more individual and group and family counseling, and then trying to use that as a springboard to getting right back into all the wonderful things that they want to do in life, school and social life, and you name it. So we've got those supports. And we also provide, you heard Adrian mention the CAT program. That's not that we bring felines out or some sort of form like dog and pet therapy. We don't use cats. That's the Community Action Team, and that's an intensive wraparound service that we provide, and we actually will go to the home and we'll provide counseling support in the home. We'll work with the parents. We work on developing those tools from the toolbox that are going to uniquely help the individual and the individual family work towards their goals and help them walk through their recovery and get to a point where they're thriving again. And so we have a number of those intensive types of supports that were embedded in the community. On a macro, and we provide a number of other services, outpatient counseling and other services. On a macro scale, we work with about 2,500 children a year, provide about 80,000 services to those kids. I usually say, and I didn't say it this time, which is funny, I usually say 2,500 unique children. And I say unique for two reasons. Number one, every situation, every individual and every youth is a unique individual. They have unique challenges, and they have a unique pathway to recovery. So they all have a unique treatment plan or care plan. And when I say unique, I mean we count the child as part of the 2,500, but we're also working with the moms and the dads and the siblings and grandparents sometimes. So that 2,500 children, really, when you think about all the other folks that are involved in the treatment, that impact really scales out further and further. And that's, I just kind of come back to a couple of things in wrapping up my comments. I'm really interested in hearing your questions, and I know we'll have opportunity to be able to share more with you through that. But talking about working with that child and working with the families, we know that there's tremendous ripple effects of the support that are provided to these kids. Some of the outcome measures are, well, first I'll start with the fact that when you look at the research, and when we keep talking about early identification and early intervention, the research that's out there is there's about a 10-year delay between the first symptom that a child has experienced and the first episode of treatment, a 10-year delay. So when you think about that, maybe that's at 9, 10, 11, 12, 10-year delay. Now we're talking about late adolescent, early adult. What can happen in a detrimental way if those issues are not dealt with in those 10 years? So starting with that, we know that when early identification is in place and early intervention and treatment is in place, that children do better in school academically. They have higher graduation rates. They have a greater likelihood to go to college, greater likelihood of staying out of juvenile justice or problems, greater likelihood of getting gainful income as an adult, less likelihood of being involved in law enforcement as an adult. So The earlier we get individuals that are struggling into care, just like any other healthcare condition, we know this, the earlier you identify and intervene, the better the short and the long-term prognosis. And that's what this group has really been working on for a long while. And it was funny when Maria was talking a little bit about some of the infancy of some of this development, and I have the graphic that we put together in my mind because what we sketched out, almost on a napkin really, as we were working together, was how to catch the child at the right place at the right time and get the right intervention. And all the things that you're hearing about that with these partners is what we've been able to put in place. And we're really blessed to be in this community that's so forward-thinking and working together in collaboration. That doesn't happen in a lot of other places in our nation, unfortunately, and we're blessed to be here. We have come a very, very, very long way in about the last 10 years, and we still have a long way to go. So thank you for being here.
Thank you, Scott, as always. I asked for it, and you delivered. Quite a number of questions, and as usually what happens with these forums, we're a little bit behind, but not too far. So I'm going to try to get to as many of the questions as I can and try not to repeat. One thing I do think is shown in the questions that I received is maybe an unfamiliarity with Baker Act. I know as professionals we tend to use this jargon pretty often. I know it was touched on a little bit there, but would Scott or Jason, someone give a kind of a clearer definition of exactly what is involved with the Baker Act process?
Sure, so the Baker Act process is the involuntary hospitalization process here in Florida. That's what it's called, the Baker Act. And essentially what that means is an individual can be mandatorily placed in a facility such as David Lawrence Centers, which is a locked facility. They have to stay there in order to be able to receive a full comprehensive evaluation, which happens. There are timelines and timetables that are built into the statute as far as how quickly our doctor has to evaluate the child. There has to be 2 evaluations done by 2 independent providers that come to the same conclusion in order for that child to satisfy the Baker Act and then be mandatorily placed on our unit. And that criteria is literally that imminently, meaning right now, there is a likely danger of that child being considered a danger to self or others. The vast majority of the time, individuals are considered to be a danger to themselves as having more thoughts of suicide, but there are other conditions by which they could satisfy that Baker Act. What that means is once they're with us, our doctor will evaluate, will obviously work with the family, get all the collateral information. That starts the treatment process. Our multidisciplinary team starts working with them immediately, doctor, nurse, clinicians, you name it, and again, in conjunction with the parents. And under the Baker Act law, we have up to 72 hours to be able to hold that person in our facility. It doesn't have to be 72 hours. It can be less than that, and sometimes people are able to leave under 72 hours. But if the person does not sign in voluntarily during that process, and it gets to that 72-hour threshold, we literally have to take the person to court, which we hold on our campus twice a week, in order for them to be able to stay in our facility involuntarily. And then the judge is the one that makes that determination. So I hope that helps.
Great, thank you. So as I'm taking a look through here, one that I'd like to jump into, because I think it's very important based on the fact that a lot of what's been presented today in terms of the data and statistics, people may not be aware of the fact that the Center for Disease Control has a survey called the Youth Risk Behavior Surveillance Survey. Florida Department of Education had made the decision last year to voluntarily opt out of that survey, and that survey, as I know and as others know, was really critical in providing data and information to our mental health, our academics, our researchers, to really understand what's going on in our communities. In July, Florida has announced that they have developed their own survey, which to be honest, heavily strips away the majority of the much needed information that we need to address these situations. So, from a policy perspective, to the panelists, how do you see the decision to drop the youth behavioral survey and the decision of Florida to kind of go their own way?
So I'm going to pass it over to the academics down here.
Well, I think without the statistics, you don't know the realities of what's happening. I can't speak to the motive behind that policy decision, but statistics are important in driving where the field is going, right? That statistics help us decide where we focus our training. So if we know there's a higher level of need in a particular area, we're going to ensure that we prepare the workforce accordingly. Statistics also drive funding. Oftentimes funding decisions are made on statistics. So without the proper data, what ends up happening is 5-10 years down the line, we would have missed the mark, right? We wouldn't be preparing our professionals to treat the most common conditions, the highest needs, and we won't have the funding allocated to the appropriate areas.
Carefully charted this water. So Healthcare Network is a federal entity. And so our reporting structure is a little different. We're unique, as I mentioned before in our presentation. We have to report our data, and we do. We report it through HRSA, not specifically to the CDC. And so this data is captured by all health centers across the entire country. As I mentioned, over 1,400. We're able to utilize that data that's more centralized to determine how and what behavioral health services we're providing and how, excuse me, impactful that they are. And so that's what makes us a little more unique than most of the panelists because they're state-ran organizations. But it is very challenging.
Good, thank you. Few others that we have. I think one of the things I'm kind of seeing across questions here, we hear quite often, we talk about comorbidity in terms of mental health issues related to diagnosis. Again, as a policy individual, I look at social issues and say they're all connected somehow. So with that in mind, we hear quite often about workforce housing, affordable or attainable housing, depending on who you talk to, as all of the different issues, costs of living. So can you talk a little bit about, from your different perspectives, because I think all of you would run into this in some way, about the challenges to recruit mental health professionals, understanding the high percentage of the ratio that we have of population to mental health professionals. Talk a little bit about the challenges in recruiting mental health professionals here to Collier County.
As was kind of joked about earlier, it's very expensive to live in Southwest Florida. It's very difficult to get people to come here, especially when they're fresh out of graduate school and don't have any money. So the finances are a big part of it. Another part is the funding in terms of reimbursement rate. Florida is near bottom in terms of reimbursement rate. So if you're getting out of school and you have a lot of student loans to pay off, Florida is not a very enticing place to come. So some of the recruiting challenges that we find are not necessarily the location. Location is beautiful, but it's living in that location that's very difficult. We have some incredible facilities down here that are good recruiting sources. And then we're also really working to find more creative ways to be able to help folks who do move to the area. And then also creating training programs down here, like through FGCU, so that we can really home grow some of these folks. So that's something that Lee Health is doing.
Yeah, I'll just add a little bit of context as well from our organization. We have 400 professionals at David Lawrence Centers, and it is a significant, it's probably our #1 recruitment and retention challenge is affordable or lack thereof affordable housing. And I do know that, even when we look at Southwest Florida, there's a big difference between housing costs in Lee County compared to Collier County. So
We had a situation where we would have people that would be willing to drive, maybe live in Lee County and drive down to Collier County. That becomes a little bit more challenged when they've got opportunities right in Lee County to work there, and they don't want to have an hour drive, down from Lee to Collier. And when the gas prices were so expensive, they've come down a bit, but when they were so expensive, then you've got that cost as well. So the lack of affordable housing is a huge issue. And I would really suggest that it is that three-legged financial stool problem that we've got when it comes to behavioral health. The one is the cost to live here in Collier County and Southwest Florida at large. And then we also have the fact that we don't have a robust Medicaid eligibility standard here in Florida, which has us with, I think, the second highest number of uninsured individuals as far as states go in the country. And then we have low reimbursement, and we've got a low level of financial support. I think we're 49th out of 50 in funding, state funding for behavioral health. So when you look at those challenges, it does make it very overwhelming in some ways to be able to grow your base of professionals under those circumstances. And again, that's where some support from NCEF and other funding sources and foundations have been critically helpful in us being able to try to meet a growing demand as well. So you've got growing demand in that equation as well.
Scott, I'm going to stick with you for this next one because I know the challenges that David Lawrence Centers went through in bringing the receiving facility to Collier County. So the question has to do with how do we overcome the NIMBY attitude. For those who may not be familiar, NIMBY is an acronym for Not in My Backyard. I was recently told we should ditch NIMBY here in Collier County for CAVE, which stands for Citizens Against Virtually Everything. Scott may be able to relate to this. How do we overcome that? We're sitting here, we're talking about the fact that, mental health, youth mental health, such a priority crisis for us. How do we overcome that? How do we get individuals to understand that these types of facilities, centers are so needed in our community?
I think forums like this make such a big difference. What I encourage when people come out to hear more about mental health and what we're trying to do as far as a plan, when I mentioned, 10 years ago or more, we started on this plan with youth mental health, and we've come so far. But we've done a lot of forums in the community. There's still so much more that we need to do to raise awareness. And when we have individuals like yourselves that come to a forum like this, we really do encourage you to become ambassadors for this message. We need for others to understand what level of challenge is out there for youths as well as adults. We didn't talk about adults in this forum, but we got a lot of struggling adults out there, whether it's mental health and the rise of suicide. I don't think people are aware that there's 2 suicides in America for every homicide. Well, that's a jaw dropper. We talk about homicide all the time, but we don't talk about suicide, and that's twice the epidemic that we have, the homicide epidemic in our country. We need to be talking about that. We know that we lost 107,000 Americans to overdose last year. We lost 67,000 Americans in Vietnam, Afghanistan, and Iraq. So in 1 year, we lost 107,000 Americans just to overdose last year. So these are issues that we need to continually be learning about and getting out of the closet, putting them out in the light, talking about them as a community. And then, quite frankly, as ambassadors, I think we need to challenge some of the stigmas that are out there, because if there wasn't a stigma, I'd probably be able to say, how many people, raise your hand, have been impacted directly by a mental health challenge or a substance use challenge, either yourself or in your family or a close friend? And if there was no stigma, I think almost every hand, if not every hand, would raise. So, okay, well, there you go. And if you're in both categories, or all 3 categories, you can raise 2 hands, right? So that's what I'm talking about. Those are the things that we have to have more of these dialogues and conversations around, and around the kitchen table and at the workplace and every place you go. That will help. I will say, though, that when it comes to building a facility, and I can attest to this in my 33 years in mental health, anytime I try to work on an expansion somewhere, What usually happens is somebody, wherever that expansion is going to be, folks will come out and they will say, you're absolutely right, it's absolutely necessary, it's an important mission, we support you, but not right there. There's never the right there place. So that's when it gets to the point where it has to be about advocacy. And it's got to be about, butts and seats when we go to the commission, the Collier Commission, or to wherever we're going to be advocating, and we need to go out there in droves, and we need to make sure that folks are aware how important these issues are, and that we really need to see advancement and enhancement in these areas in our very community. And so I hope that helps.
Absolutely. We have about 10 minutes until wrap up, so I'm going to do my best to get through as many of these questions as I can. I'm going to hold with a point that you made there, Scott, and I thought it was a good one related to stigma around mental health. For the group, the question is there a pathway to change the definition, looking at mental health as physical health? And the note that's made here is treating the brain is just as important as treating any other organ. So
some of you may be aware that I think about 4 years ago, they added a requirement in grades 6 through 12 to have 5 hours of mental health education. And that's not just 5 hours during the time you're 6 to 12, that's 35 hours of mental health education over those 7 years. And we were tasked with creating different modules and ways to do that that weren't just in an English class or just, so it's quite a challenge. That since has been rebranded and called resilience education. So it includes a lot of character education, grit and resilience, things that will make students successful after school, whether they join the workforce or go to college. But still part of that, a good 2 solid hours of that is around destigmatizing mental health is a huge part of that, and understanding where you can get help and that it's okay not to be okay. And so that's been a big part of those modules that we roll out to students, and they are an interactive part of our Canvas learning system, and there's a dedicated time about 6-7 times throughout the year, and we use our students and our staff to create engaging videos, also using stuff from YouTube. There's a lot of great stuff out there, and Seize the Awkward and some of these other videos that have been created that really push in on stigma and destigmatizing. And I think, quite honestly, probably the problem necessarily isn't in our youth nearly as much, right, as it is in some of us older folks. But I think in some ways, at least, that's positive that, now I would say the first group of, 9th graders probably graduated last year, having had that full continuum of that curriculum. And initially we had, I had designed some quizzes that were in there, very easy kind of quizzes, and it was interesting to see that there was a very deep understanding. You get back, 15,000 responses, on a question, and one of them was, is mental health a sign of weakness? And we got really good results on that. That no, it's not a sign of a weakness. It doesn't mean I'm a bad person. It doesn't mean my parents did something wrong. So, I like, having those opportunities, and hope that it's going to lead to better things in the future.
Rick, I'm going to stick with you for 1
Sure.
second because I think you actually are touching on another question that came up about what is the role of the student in identifying and helping to help other students with mental health challenges to seek that help. And I think you touched on it a little bit there.
Sure.
Yeah.
So, we have different clubs also throughout the school system. One of them is called our We Dine program, which originally was sort of branded around, that student in middle school or high school that is sitting alone, eating their lunch all the time in a corner or in a stairwell and not really interacting. And so the club, based on a school sponsor, would do some training around social emotional learning and engaging those students that may be sitting there and not saying, hey, do you want to come over and have lunch, but actually, having a classroom space available for kids to come together and talk and interact with one another. We also have some clubs, and it depends on, again, a diverse student body and somebody that really wants to champion it, and so they can ebb and flow because the students have to be interested. But around mental health and having like a mental health club or those types of things where kids come together and let other kids know that they can be a part of the assistance. And I think a big thing that we try to get across too, even in that curriculum, is, you can help somebody. It's not, it's not rocket science to say, hey, I've noticed that you really don't look like you're happy. You can talk to me, or you know what, if you're scared to go and talk to somebody, I'll walk down to the guidance center with you and we'll get somebody to talk with you. And we even train our guidance secretaries and office staff. When those kids come in, it's not just the school counselor or the mental health professional. How you react to that child immediately when they walk in is very likely whether or not in 5 minutes they decide to walk out or not. That sense of urgency, hey, I see something's kind of going on here. Why don't you wait a second? I can get somebody to talk to you. We're going to help. So that's a big part of also our whole youth mental health first aid initiative. And if we're ever able to, there's a teen version of that, which I think would be, very helpful as well, because so often they are the folks that know before the adults do.
Great, thank you. Our time together is quickly drawing to a close, so I'm going to wrap up with one last question, kind of in a rapid-fire format here. The question was, what is one thing that each person in this room can do to help when they leave here today? So if we want to start with Beth and make our way across.
All right, hot seat. Listen.
Yeah, I would agree. I think listen, observe, engage, and what's that?
One word.
Oh, it was one word?
One thing, that's okay.
Okay, so sometimes I go off script. I didn't know that rapid fire meant that. I'm going to talk for a few more minutes about this topic. Just kidding. Dr. Rosado, one word, okay? Please follow the rules.
I'll have to break the rule also. It's hard to find a single word.
I know, now Beth gets you.
But I'll steal the phrase from Rick and say it really isn't rocket science to support someone. I don't have time to tell the whole story, but me as a psychologist, I have a young child who struggled with mental health, and I'm a psychologist, and I teach this every day. I didn't recognize it. Or maybe I was in denial, I don't know. But I'll tell you, I hang out with these professionals all day, and so I could ask any professional, any expert, any question I want. But the single most important thing anyone ever said to me in our journey was just to pray with me. And it was the most unexpected thing that I came across. I didn't ask for a prayer. I wasn't expecting one. I just told someone. It was me and my wife, and we were talking to someone about it, and she just stopped, and she said, you know what? I'm going to pray for you. And she prayed, and at the end of that prayer, I felt so much better. And I believe in prayer, and I believe there was something about the prayer that worked, but it was just the fact that she offered what she had to offer, right? In her case, it was a prayer. So don't make it rocket science. Whatever it is that you have to offer, it may be, I'll babysit for half an hour. That's huge right there. Anyone who would take my kid for 30 minutes, you can have him. What do you have to offer? Offer that. Just start there. Yeah.
So I know where Dr. Rosado works. He works right there with us in Immokalee. I'm going to come get a prayer. Yes, no. It's so quite fitting and appropriate here today. The one word, but I'm going to use it in a sentence. I would say lobby, but that's not quite appropriate for us as nonprofits. So I'm going to say advocate. Folks, we need you to advocate to our legislatures. It matters. It matters. We might be the healthiest in the entire state, but when you calculate us against the country, and it requires advocacy, we've seen a county commissioner make a difference. We know what happens when we advocate. So,
I would say that the folks in this room have already started the process that I would say is important, which is getting involved. There are so many organizations here in town, and I would really encourage you to be active in those organizations. Those are the organizations who are directly touching the kids in this community and directly affecting them. So your involvement is just like Dr. Rosario is saying, is that may be your way of being able to help. And so being involved in that gives us the opportunity and the tools so that we can go out and do what we're good at.
And I used the word before, but I would say act as an ambassador. So you've heard a lot here today. Actually, acting as an ambassador incorporates all of the things that were just said. You can listen, you can observe, you can share, you can pray, you can advocate. There's so many things that you can do, and we need for you to do it, because that's what's going to eradicate the stigma. And I kind of laugh about this a little bit in the sense that we've gotten really pretty far along when it comes to stigma around healthcare issues, when you can have commercials on erectile dysfunction, but you still can't talk about behavioral health, and you still can't talk about addiction. And so we need to change that narrative. And the only people that can change that narrative is if it starts with us. And if we take the narrative to the kitchen table and to the workplace and and our faith communities, every place we go, our schools, and once we do that, we'll start that ripple effect that I was talking about before that's going to change and save lives.
Well, thank you all for that. And how about a round of applause for our amazing panelists? Thank you so much, not just for the time today, the information today, the insightful stories and perspectives from the boots on the ground work that you do, but for that work that you do as well. A few things as we close. Going back to that question, I love what Jamie said about advocacy. He knows that that's something that I'm a huge fan of. So I will give you a takeaway. I'll give you two. As you look to advocate and how to advocate, the Florida legislative session started yesterday. Please be sure to look at a specific bill. Senate Bill 164 is a bill on solutions for mental health professional shortages. And that program basically would provide incentives and tuition reimbursement and so forth for mental health professionals to incentivize more students and more individuals to move into that critically needed workforce here in Southwest Florida. So that's definitely one piece of legislation that I would ask you to get behind. As we close, again, a few reminders. First, if you didn't have an opportunity, or even if you did, please feel free to stop by the resource event that's being held out in the courtyard, learn a little bit more, have the opportunity, if I didn't get to your question, and I apologize if I didn't, to speak with someone out there to see if you can get an answer on that. Also, please consider returning here tomorrow to the Naples United Church of Christ at 4:15 p.m. to attend a free performance of Acceptance Pending. Acceptance Pending is a show focused on the mental health strains associated with the college admissions process. The show is produced by composer Gabriel McDermott, who is here with us today. Gabriel is a Florida native, a student at New York University, and a champion for promoting mental health through his music. His first production, he first produced Acceptance Pending for the Edinburgh Fringe Festival and has gifted the U.S. premiere to the Naples community before the show opens on Friday in Bradenton. So again, tomorrow, 4:15 p.m., it's a free event. If you have the opportunity, please come and join us. Once again, I would like to thank our panelists for sharing with us today, our sponsors for their support of this wonderful event, the Naples United Church of Christ for hosting us in this beautiful facility, and again, to all of you both in the room and who joined us online for spending your time with us today to see what you can do to support youth mental health here in Collier County and across Southwest Florida. I hope this session was enlightening for you and that you leave today with a strong sense of what these exceptional programs are accomplishing and the work that remains as we seek to address youth mental health in Collier County. It has been an honor to do this. It always is. Thank you so much.